every time she would come in, she was like amazed. And we do have and she was like, oh my God, even my boyfriend and this, they see it, of course she sees this too, but sometimes when you look at yourself all the time.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Luzine Egizarian of Excelis Med Spa. She's a board-certified family nurse practitioner with a specific focus in acute care, wellness, and aesthetic medicine. She has been in the medical field since 1999 and has acquired extensive hospital experience. As a primary care provider for just under 5 years, she has worked closely with patients and clients to improve not only their physiological, but also psychological state. She believes in following a holistic approach while treating her patients and always puts their needs above all else. She has combined her extensive training in functional medicine with her skills in non-surgical aesthetics and wellness practices to help clients make impactful and positive changes towards a happier and healthier life. So Luzine, welcome and glad to have you here.
Nice to meet you. Very excited to be here with you guys.
Yes, let's dive right into it. How did you first get interested in medicine?
Well, since the childhood, I've always, I don't know, for some reason wanted to be a doctor or a provider. Back in my country, we didn't have like mid-level providers, but doctors. So I was always interested in that profession. It was drawn to me. I don't know. So, and it didn't change since, I grew up and everything. So I started doing my speech therapy back home and working with kids with mental retardations. However, when I did immigrate to this country, I pursued, I went into medical field, and started as a medical assistant. After that, went in to do the LVN, RN,
Got it.
nurse practitioner. So I've always wanted to be a provider. I don't know. I guess I like helping people, and seeing their improvements and giving them back the quality of life as much as we can. Of course, there are some instances, especially when you're dealing with very sick people. Unfortunately, it's out of our hands, but whatever we can do, right? So I've always wanted to do that, and I enjoy every single day of my profession. I do.
Nice. So then how did you make that transition over into the aesthetic side of medicine?
Honestly, when I did, I got into working as an LVN back then, at the hospital, home healthcare. And, as those years going, the aesthetics kind of started getting into trend, and you've been seeing, oh, Botox and dermal fillers, how much improvement it gets. I got interested, of course, and started getting into it. And I really enjoyed what I love about my now what I do is a really good balance between really sick people and healthy people and happy place. So it kind of gives me that good balance. But it was always amazed, I was amazed by that because you see these little tweaks and everything and how much difference it makes. And actually, it's not only for beauty, it's actually really helping people in their confidence, quality of life, because it's not only like, oh, you know what, I fixed this wrinkle or put a dermal filler. Some people really bothered by some of their features that they have not only on their face but also on the body. So therefore, it's not a very focused treatments that we do. It's again holistic. We're looking from the top to bottom, and like let's say for somebody comes with the acne issue, right, or obesity, it's not only the weight, it's not only the pimple that you get on your skin. There's so many other things that might be involved in contributing to this issue. So therefore, like you work it out like a whole, so same approach like you do with sick people at the hospital, same thing you're doing over here. And when you do say, oh, you know what, your problem is most probably from this, it's like an eye opener. What do you mean? And so you start. So that's what I love about it. And Yeah, I treat my clients slash patients exactly the same way, digging in, doing a thorough assessment, what might be the problem, or why is this bothersome to this person. And that little change can make a huge impact on their life because now they're more confident, they're not covering something, or they feel good about themselves. So pretty much that.
Okay. And I think you bring a very unique approach to aesthetic medicine because you have the functional medicine background and you're coming kind of,
Mm.
you're looking for more the root cause of what the issue is. Where I think most people that are in aesthetic medicine think about, oh, it's mostly just surface level. It's just from the outside. They're not thinking really about the inside part and getting that fixed first so that it reflects on the outside.
You do a band-aid quick fix. And yeah, most of them. Yeah, I mean, I don't know, maybe it has to do with the background, the way you look at people, the way you look at the problem. If you don't have an extensive background in acute care, I don't know, that's my, thinking process of thought. But, if you don't have that, then you don't dive in really, deeply to the root cause. And that's why probably most of the, or some people just, I guess, business driven. I don't know how to say it. Sometimes I would have clients that would come in and like, oh, I read about this treatment, or this is what it is. What can you offer? And some don't like the answers I give them because, again, I like to fix from the bottom and go up, work it out. So later on, we have that foundation, and your treatments are more effective and the longevity is longer because we are, aiming at the root cause. But some of them don't like it. Some people want just quick fix, look good now. I don't care about later. And that's not my approach. But hey, I mean, we're working together, and if them, I just warn them, if that's what you're looking for, then these are the consequences you're gonna know. As long as you know and you are happy, then I'm happy. But yeah.
Yeah. Okay. Now, Luzine, what are some of the most common treatments that your clients and patients come to you for in your practice?
Honestly, over the years, not I haven't been in aesthetics for like decades, but over the years, I've noticed that nowadays, especially even young ones, and that kind of surprised me in the beginning, but they want more preventive. They want more natural looking treatments, maybe like, let's say, PRP, PRF instead of like a filler, right? Like especially for under eyes or something. So that's changed in the beginning, I guess, when there was like the neurotoxins and the fillers just came out onto the market. A lot of people were just mostly interested in those. And back then, I guess, we weren't this spoiled. We didn't have the variety of treatments, and the drugs that we have now. But yeah, that's changed. Usually people back then, were like, oh, I want my lips like this. I want like these maleficent chicks, whatever it was, or frozen. I don't want to move, Now, no, I want to do something, but don't make me looking like plastic, like that I don't have any facial expression. So that's changed actually. And a lot of people are interested in more, like a natural looking treatments, and or like, let's say, I don't know, fixing the problem from inside out. Not that I do a lot of functional medicine in my office, I don't. But I can kind of combine and give them like a recommendation, like do this and that, and then if there is a big problem, of course, refer them out for that. Yeah, but that definitely is changing, the way people now think.
Okay. I also want to touch the topic of weight loss. I mean, the GLP-1s, it's all the semaglutide, tirzepatide, all these drugs have been coming. I guess they become more popular, I would say, over the last couple of years. But what are your thoughts on the service of weight loss, all these drugs coming out? What's your general thought about them?
Honestly, I like it. I like them. I offer it in my office, and we do weight loss. Sometimes I understand with any drug that comes out, and there is this hype about it, right? And people talk about it, but they get always these mixed views because they read online, oh my God, this, or somebody did it and something happened, so people get these wrong ideas. We just need to understand that GLPs have been around for quite a while. They're nothing new, okay? Maybe some brands came out and they're new, but they're peptides and they've been used for not weight loss, but mainly for controlling diabetes, type 2 diabetes, for a very long time. Therefore, there are plenty of studies, data about it, okay, and the safety. And longer you use something, of course, you're going to have more data about it and studies in that showing, for some people who've been on it for a very long time, what type of other benefits they got, right? I think very positive, and I do not bring anything into my practice as long as I know and I've done my research and I know that it's not going to hurt in any ways. However, with any treatment or a drug, diagnostic tests, anything, somebody comes in, or if it's purely with like just weight loss, nothing else going on, I still do a thorough assessment, a very comprehensive. Sometimes people feel great. They don't have any symptoms and they're here to lose some weight, to, you know, be ready for beach. But when you do the blood work, it shows something else. And so therefore it's good to know, like, oh, you know what? Your A1C is, you're already pre-diabetic. Have you known that? Or your kidney functions are a little bit off and whatnot. And it's an eye opener, Oh, really? Oh, that's what's going. So that's something good to know, and then improve it. Like with some people who are already pre-diabetic, or they have a like a fatty liver elevated because of their weight and whatnot. So when you do that and you recheck in 3 to 6 months, depending on the lab results, then you see the improvement. So it helps, or the other way around, you go like you're not a candidate. So that's how I do in my clinic. I need to have that foundation laid. I need to know everything as much as I can, of course, whatever, with the blood work, with their thorough assessment, with their past medical history, family history. Once I know that, and we decide that the patient is a candidate, then we draw their a personalized treatment plan, basically, and we get our results. That's how I do in my clinic. And but I heard like there are clinics, weight loss clinics, that people will go and nothing's done, and oh, pay this much and here's your syringes, go and do it, and just come back when you're out. So I don't know.
Yeah, so there's a couple misconceptions I want to get cleared up with you on the weight loss because I've heard a lot of different things about it. I've talked to a lot of professionals about it. So one thing that I've heard is that people talk about the like your face gets sunken in when you start taking it. So, and I've kind of heard like if you take it, you lose all this weight, but you're also losing a lot of muscle mass as well, which is not good for you. So, in what situations would you want to use these weight loss drugs, but also making sure that you're not losing the muscle or you don't have that, I forgot the name of the face, but it's basically like you have this like sunken in face from taking the drugs.
Oh, Ozempic face. I
Ozempic
say
face, that's
that's
right,
one.
that's right.
Yes, you're absolutely right. And that will happen, especially with somebody who lost tremendous amount of weight. Some people get it faster just because, how you lose weight and it's not proportionate. You might lose more weight in your face rather than in your body when you go like, what is happening? I don't need to lose anything of it. But, it's your body, right? Yes, unfortunately, that can happen. And it's not only with GLPs. If you lose weight, you've done bypass, gastric sleeve, or fasting, and you lose it, you're going to lose it. So therefore, when people come into the clinics and want to sign up for the weight loss, also it's a lot of teaching. It's a lot of like signing, like in a way that your patient needs to be on a same level and on a same page with you when you're talking to them. So when they come to me and they say, oh, I want to start and everything, I say, we go through everything. Now you're ready to start. You need to be on the same page. Okay. It's don't rely on this medication only. You gotta watch what you're eating. Try to eat, as healthy as you can. Small portions. You gotta do some activity, physical activity, cardio, jogging, some weights. You gotta do some weights for, keeping your muscles. So much you can do with patients, right? Some people are very compliant and they will do whatever it takes. So they'll work out. And with those type of people, it's like if you lose tremendous amount of weight, of course you're gonna have some lack. So you always have to consider and weigh your benefits. Do you like your weight is causing you more issues health wise rather than your looks, right? You're going to have to always keep in the back of your mind some tightening, like laser tightening treatments, maybe some biostimulators to kind of like rejuvenate. And so you got to weigh your benefits versus, like pros and cons, I want to say. And if it's the weight is the major issue, not only for the looks, but also a health issue, then, you got to lose the weight and then consider doing that. Also, I always tell them, like, let's say if you've been on a weight loss program for more than 3 months and you are losing, the weight and everything the way we planned, it's a good time to start taking some vitamins, like supplements. And I will tell them, and it's individualized. Okay, so I will recommend them some supplements to be on to so you won't feel like that fatigue or a little bit of weak. I don't want to say weakness, but fatigue or worn down, less energy. So there are things like weight loss is not only with GLP, there's so many things involved with it. Okay. And so that's why I have that discussion always with my clients and I enforce it. As I said, some of the clients will be, doing everything. And those are the ones who get the best results without a lot of side effects. But they don't, if it's a financial problem or if anything, but they know about it. So they're not surprised, they're not disappointed. They knew that was going to come at some point. So
Okay. And another thing I've heard when it comes to GLP-1s is it something that once you're on it and you start losing the weight that you have to stay on it for the rest of your life? Or is there a plan to eventually wean you off of the GLP-1s completely?
oh no, you don't have to be on it. Achieve the weight loss goal. We're there, right? They're nice, good, everything. But they know like once they're off, they might not keep it off. So we put them on maintenance program, which is basically you go down and you stay on a low dose, very low dose, but it keeps them, it maintains the weight, right? Some people, because of the financial issues, or now they're really good at it and they know how to control, they eat little portions, intermittent fasting, they're active and everything. We win them off and they can go off of it. You don't have to be on it for a very long time or the rest of your life. So basically, GLPs slow down the stomach emptying. That's how it helps you to lose weight, right? So you're unable to eat the portions or the sizes, whatever you were doing before it. However, if you do stop the GLPs, your stomach shrinks,
Hmm.
like with bypass or like when you're doing dieting and whatnot. So now it's you that you need to be on top of it and control the amount of whatever you're eating, the amount you need to be able to control and not to stretch your stomach. But if you don't do that and you go like, it's okay today, it's only one day. So you're going to stretch it out. So you go back to whatever. So nothing is forever in this world, nothing. So people expecting to be on GLPs and stay that way with that, but when they do stop the GLPs and just stay that way forever, it's not going to be possible unless you really do what you need to do. And I know sometimes it's really hard to keep it that way because of the stress we go through, the hectic schedule we have. Sometimes people don't get to eat their meal at the right time. They come home at 9 and they eat. So, that's what it is. So, no, you don't have to be on it for a lifetime. But yes, you can stop and then you can restart or you can be on maintenance. Yeah.
Got it. Okay, that's
There
good
are
to know.
a lot of health benefits though, when you do studies show that, it helps with diabetes, with dementia, with brain, working with kidney functions, with cardiovascular, sleep apnea, so there's PCOS, so it's very health beneficial. But then again, it comes down to financial situation too with people. So
Okay. Now, Lucine, I'm curious, what role, I want to switch over to how you approach your patient care. What role do you believe artistry and creativity play in how you approach patient care? I think most people think about medicine, it's creativity is not something you necessarily want to hear when someone is applying medicine to you, or artistry. I mean, I think a little bit more in the aesthetic side, yes, but what are your thoughts on the roles that artistry and creativity play in the work that you do?
you look at them as a whole. You don't look at them like patient will come in and say, "Oh, you know what? My eye bags are like bothersome. This is what bothers me." And then you look at them and you go like, "Okay, you tell me what bothers you, and then I'm gonna tell what I think about you. What are my thoughts, right?" And so when they come in and they say that, and we have this conversation, I look at them and then I go, "Okay, so." In order to fix this, let's try this because we're gonna have to. That's how I look at my patients. I don't look at once they say, "Oh, this is bothers me," but then the whole another, the whole face is in really bad shape, and you have to. So I give my recommendations in a way of, what do you think about this? Because when I look at you, I don't look at your eyes only. I look at you overall, your chin, your neck, your everything. Yes, it's bothersome. Yes, there is a problem, but you need to fix other things in order to get the best results or best outcome for that particular client. And that's how I do it usually. That's what I mentioned in the beginning, that sometimes when they come, they don't agree with me because that's my approach usually. Afterwards, when of course we do before and after pictures, right? Every time they come. So we both see that progress. Like every time you come, oh, see, after this treatment, this is what improvement we got. It's so satisfying when you see the patients, like, oh my God, this has changed. Oh my God, you look this. And then, or when they walk in, they go like, oh my God, you don't understand. My friends or a family they see and they say, what did you do? Oh my God, you look so refreshed. Oh, and then you can see that happiness. I don't know, that confidence in them. And that makes me the most happiest person in my life because then I see, the results and I'm doing something right. So I don't know, that's my thing.
Yeah, no, it's good. It's good. I mean, is there maybe a story that you wouldn't mind sharing of maybe just maybe a client or a patient that really stands out in your mind of them coming in, they had a really tough case or a tough situation, and how you were able to get them basically a really good result in the end?
I have few, and I mean, I have now. I'm actually today she's coming to me again, and she was one of my cases that and hasn't done anything before this. Very beautiful woman, but a lot of things were going on, And when she came in, she was like concerned about her eye area, actually. But when we had sat down the conversation, and I always want to see what is their main goal, like what do they want to, how much improvement they want. And then of course it has to be realistic expectations. If you're in your 60s or whatever and haven't done anything, you gotta have realistic expectations. So when we had a conversation with her and I actually redirected her, I said, let's start with something else for your face and neck, then, after a few treatments of that, we can go back and start with your eye as well. Because when I'm looking at you, I look at you from here to here. I don't look at you only on your eyes. And she was one of those, one of the best clients you can have. Like, oh, yes, okay, I trust you. I believe your judgment. And it's hard sometimes when it's your new patient because they don't know you. They can read about you, the reviews and everything, but they don't really know. So she agreed. We've been doing treatments. Today is her fourth treatment for the face, and then after that, we're starting her eyes. And every time she would come in, she was like amazed. And we do have and she was like, oh my God, even my boyfriend and this, they see it, of course she sees this too, but sometimes when you look at yourself all the time, you kind of think, oh, this is how it was, but others see more, right? And she was so, like, she was like, I can't believe it, you were telling me, but I wouldn't imagine this much improvement. And everybody's different, of course. There are some other factors that can play a role in how much improvement you're gonna get. It's the lifetime, lifestyle, the habits, smoking, exercising, drinking, and whatnot. But overall, there is they're gonna get an improvement no matter what. But how much, it's gonna depend. It's individual. But hers are awesome, and every time she comes in, I can't wait to take those pictures and see, how much improvement. And yeah, she's really, really good, and she feels like I feel so much confidence, so much more confident, and I'm not putting as much makeup. I'm not covering a lot of things, because it's getting like it's reversing time basically. So I feel like I'm 20 years younger than I am. Maybe she doesn't look that much, but that's how she feels, and that's the best feedback as a provider you can get basically, because it means you're doing something right.
That is a wonderful story. It's a wonderful story.
Yeah, and seeing that, like happiness in your client's eyes, and that I think with any provider, physician at the
Mhm.
clinic, at the hospital, anywhere, when you get that positive feedback, it really makes your day.
Mhm.
I
Yeah.
don't know.
Now, Zine, I'm curious, what is your vision for Excellus Med Spa?
You know, um, I'm working hard. As I'm not a full-time aesthetic provider, as you know. It's like half and half. I'm in urgent care, I'm in hospital, and I am in my clinic, but it's my baby. That's my very first business in my life, and I started it, and I'm a very, very cautious person. I don't like taking risks.
Mhm.
I don't know, that's how I am. And so, but I risked it and I started. And as you know, in California, this type of businesses, or market is very saturated. So it makes it a little bit harder to grow. But my vision is like, as long as you're doing it the right way and you're treating your patients like you would treat yourself or your family member, you're not doing it only for the money. I think you will thrive, and that's my vision, treating my clients the way I would treat myself, and not, taking their money and, oh, okay, you came, as long as you pay me today, I don't care what happens. It's hard sometimes,
Yeah.
but I will never change that concept, the way I work, because I have morals, ethics. So, but my vision is it's gonna pay off.
Okay.
So we're getting there.
Yeah. It's a bright future ahead. Okay, so Louisine, I have one last question for you, but before I ask it, I do want to point people to your website at excelismedspa.com. Now, my last question for you is, what does beauty mean to you?
Beauty has to do with your confidence, your basically whatever, the way you look. So if somebody can be very beautiful from outside, but not very beautiful from inside. So it's a tight connection between inside and outside.
Mhm.
However, sometimes somebody can be very beautiful and have all the check marks as far as their inside goes, but they have some minor problems from outside, and that really hurts their confidence, the quality of life there, and they're hiding. So that's why, some of these treatments, as I said, nowadays we're very spoiled. We have a various treatments that we can offer. We basically help people to feel beautiful. Okay. Whether it's a pimple, it's a scar, it's a complexion problem, I don't know, or some wrinkle over here. When we match the inside beauty with the outside, that's a complete picture we get. So beauty for me is completing and filling in those little puzzles, missing links to get that 100% beautiful look from inside out.
Great answer.
That's what it
Well,
is.
there you have it. Luzine sharing her expertise. So, Luzine, where can people contact you in your practice?
So they can contact us through Instagram, through telephone 818-578-4455. All of the links are on our website. They can connect, through email, xlsmetspa@gmail.com. So various ways, as long as if you log into, I mean, not log in, if you visit our website, all the, ways of contacting us are in there. And we're located in Glendale, so open almost every day. So call us, and if you see anything that you're interested here, we're here to help you.
Okay. Well, Luzine, thank you for coming on. This is fantastic. And thank you for sharing your knowledge.
Thank you. Glad to be here, and thank you very much for uh, putting this word out for our business and some educational, I guess, material.
Yep. Fantastic.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.